Hi, okay, so today we are going to learn about how to diagnose the patient as a physical therapist. I started reading a book named Orthopaedic Physical Assessment by J.Magee, so I decided to make notes out of it, and from those notes, I thought, why not make a video? So here I am creating a series of videos, so it can be able for the students of physiotherapy students to be able to understand how can you perform a good diagnosis. Most patients are not diagnosed by physical therapists, but they are usually referred. But in some or many occasions, it can happen that you would have to perform a diagnosis on your own. So, for that matter, you should have a certain or specific amount of knowledge to be able to have that ability to do that. Okay, so let's start with this. In the book that I was reading, I have made these notes, and from onwards we are going to talk about a lot of points and a lot of information which will be easier for you to understand. Okay, so let's start with how do you diagnose the patient. As a therapist, you are going to see the patient's history, so you are going to ask a lot of questions. You are going to start with the history of the patient, and general information includes asking the name of the patient, the age of the patient, what is the sex of the patient. You are going to assume is it a she or he, male or female, same thing. No, wait, different thing. So next thing is that you are going to ask, what does the patient do? What is the occupation of the patient? Okay, because that is also going to tell you a lot of information. Afterwards, you are going to see that the patient that is presented in front of you is saying that he or she is experiencing a lot of pain or have certain kind of symptoms. You are going to ask the current symptoms first. Okay, what are the current symptoms present? And then you are going to ask, where are those symptoms? Okay, is it back pain? Is it wrist pain? Is it an injury? Where is it? Okay, these are general information. Once you're getting an idea about the general information, you are going to follow to understand the kind of pain that the patient is feeling, because all of this general information is going to lead you to understand what is the pain. Okay, so first I am going to talk about a lot in this video is understanding the pain of the patient, because that is the most important thing first, because that is going to give you a lot of information. The basic purpose of the diagnosis is not to make and assume things, but to gain a lot of information and then perform an initial diagnosis. Then you can easily understand where the situation is presently at the current standpoint. Okay, so let's understand the pain. How do you correlate it with the symptoms, and how you can perform a diagnosis based on that information? So this video is all about going to be understanding the pain of the patient. Okay, let's start with pain. From pain, we are going to talk about the types of pain. Here I have 3 different types that I have explained. It depends upon the situation. They can be different, they can be other types, but here we are just going to talk about these types because I am just following a certain kind of book. You can read another book, you are going to find other information. Okay, so let's see. First, pain is, it could be constant, it could be periodic, or it could be episodic. Well, now what are these 3 types of pain? A constant pain is usually the patient saying that the pain is not stopping. He is consistently feeling that pain and is just not, having any kind of stop. So you have to assume that maybe there is some kind of a visceral lesion involved in this case. Now, what is a visceral lesion? Visceral lesion means that there is some kind of a soft tissue, internal damage inside the body, or the soft tissue or some other kind of body inside deeply has affected. So you have to assume that in this case, because the pain is constant and it is not stopping at any point, at rest or during activity. But again, this is not a diagnosis. We are just assuming things, getting a lot of information from what the patient is saying, and then we are going to make an actual diagnosis based on a lot of things. The second pain is a periodic pain. If the patient says that the pain is occasional, means it sometimes happen, and it the patient becomes relieved when he or she changes his or her posture or a position. If he's sitting, the pain is not there. If he's standing, the pain is there. That is a periodic kind of pain. Another pain is the episodic pain. That is activity related, means that it affects his or her sleep. Patient is looking for a comfortable position, so whenever he or she does a certain kind of activity, the pain is intense and all of a sudden is just so much that it is unbearable. But in other cases it is not there. Okay, but if you see in situations, most of the situations, the patients that are going to come to you, they are going to be periodic pain, because they usually explain that in orthopedic situations, this is how the things are, because you are, as a physical therapist, you are going to see a lot of people with periodic pain, means that the symptoms are there, but when he or she changes his or her posture or position, the symptoms are not there anymore. Okay, the next thing that you have to look into is where the pain is at rest or at night. Okay, that is very important because this tells you further information. Now, if you think that the pain is not at rest but at rest and it is still not getting any better, then you can assume that it could be a bone pain, or it could be a systemic disorder, because a bone pain involving a fracture still does not get better at rest. It is still there and it is very strongly there. If it is a systemic disorder, it means there are multiple organs involved in the body that are causing that pain for a very long period of time, and even if at rest you cannot see any kind of change in that pain. And if there is a systemic involvement, you are going to refer the patient to a further medical checkup, because that is out of the scope of your work. Okay, next thing, you have to see if the pain is at night or at day, and you have to make assumption further on based on that. So pain at night is worse. What does that tell us? That tells us further things. If there is a pain at night and you have seen that the patient saying that the pain is at wrist or the pain is at the shoulder joint, then you can say that it could be a carpal tunnel syndrome or it could be a thoracic outlet syndrome. Why? Because you see that in carpal tunnel syndrome, if you have studied carpal tunnel, you will know that the median nerve in the wrist gets compressed under the carpal ligaments, and this leads to compression of the nerves and causing even an immense amount of pain at night. Okay, and similarly in thoracic outlet syndrome, this is also involvement of the compression of the nerves or arteries or the veins. So these are both the conditions, thoracic outlet syndrome and the carpal tunnel syndromes. Both of these conditions are those kind of conditions which involve the compression of the nerves. So in these cases, the pain is worse at night. Okay, that is just again an assumption, not an actual diagnosis. Okay, the next thing that you are going to ask the patient if the pain is getting better when he sits or bends forward. When the patient says that the pain is increasing when he's bending forward, then that could indicate maybe it is a disc pain. Why? Because a disc pain, let's see, here is a diagram of an intervertebral disc and some vertebrae. You can see that there is a certain kind of inflammation or a protrusion outside at this point. Okay, so if a person bends forward, that means that the vertebra from this position is going to go into this position. Okay, when this position happens, the disc between these vertebrae is going to cause a protrusion like this. Okay, it's going to cause a protrusion outward like this, and the nerve moving from here is going to get compressed. Okay, this compression leads to pain, and pain is again very immense. It could be sciatic, it could be paresthesia. There are a lot of possibilities. So when the patient says that the pain increases when he or she bends forwards while sitting, then you can assume it could be disc involvement, because this is a situation that happens in this case. Another thing, that if the patient says that the pain increases when he or she twists, mean he rotates his or her spine 180 degrees or 360 degrees to a certain movement, left or right, this causes pain, then you can assume that it could be facet joint involvement. Facet joints are these joints in the vertebrae, okay? And why is this pain there? Because there is some kind of a degeneration or articular cartilage tear and wear present that is causing this kind of pain. So you have to assume maybe the rotation of the spine causes the facet joint involvement, while the bending forward of the spine causes the IV disc involvement, okay? Further on, moving on, we are going to see the pain quality. Now we have understood the type of pain, when does it happen, how does it happen, and now let's see the quality of the pain. What kind of pain is it? Is it sharp? Is it bright? Is it simple? Is it boring? Is it okay? Is it just very, very much? That is going to tell you a lot of things. If the nerve pain is sharp, it is bright, it is burning, that means that it involves a nerve pain. Okay, there are a lot of structures in your body, nerves, bone, vessels, muscles, and all of these things present with the different kinds of pains when they are disturbed or presented with some kind of discomfort. If there is a sharp, bright, or burning pain according to the patient, then the pain could be nerve pain. If there is a deep, boring, or a localized form of pain, then the pain could be bone pain. If the pain is spreading and aching, it could be vessels involvement, blood vessels involvement. Or if the pain is hard to localize and it is dull and it is similar to an inert tissue pain, it could mean that that is a muscle pain, okay? Another thing that you have to remember about is the neuropathic pain. Neuropathic pain means that the nerve has been involved, and it could be sciatica or it could be paresthesia. So far we have studied about the type of pain in this video. I hope it is good. In the next video, we are going to talk about the further questions that you have to ask while taking the history of the patient, so you can perform a further diagnosis and get a better idea. Okay, thank you for listening.